As we look back across the decades, we've witnessed a global revolution on many fronts. More women and men are using modern methods of family planning, which has risen to 55% throughout the developing world. Children are healthier, and child deaths under the age of 5 have fallen to 7%. Maternal mortality is dropping from 450 deaths for every 100,000 live births in 1990 to 290 in 2009. And girls are better educated, with nearly 85% of girls completing primary education. And that's a remarkable achievement. But there is one challenge where we're sadly behind: malnutrition in mothers and children, which continues to impose a staggering cost worldwide despite having the solutions. Today, malnutrition contributes to the deaths of millions of children every year, which translates into more than 1 out of every 3 child deaths. Let's take a look at our trend graph. This is Hans Rosling's bubble graph, which some of you may be familiar with. We're going to see how malnutrition has changed over the last 20 years across the globe. Now here we have the bubble graph where we're going to focus on the relationship between malnutrition and life expectancy. On the left axis, we have the percent of children under the age of 5 who are chronically malnourished with their growth stunted, or low height for age. And this axis goes from 0 up to 75%. And on the bottom axis, we have life expectancy, or the average number of years a newborn infant can expect to live, going from 25 up to 80 years. And each color represents a different region of the world. So starting with the red, we have East Asia and the Pacific. The orange is Central Asia and Europe. The yellow is for North and South America. The green is Middle East and North Africa. The light blue is for South Asia. And the dark blue is for Sub-Saharan Africa. And these countries are located more toward the back of the pack, with lower life expectancy in 1988. And the size of each bubble corresponds to the population size of that country. So the bigger the bubble, the bigger the population. And in 1988, we can start to see an association. Countries with lower rates of stunting have higher life expectancy. The big light blue bubble here is Bangladesh, with about 70% of children stunted and life expectancy at only 52 years. And also about 20 years ago, the yellow North and South American countries are spread out across the trend graph. Bolivia and Peru have about a 40% rate of stunting, while Brazil has a significantly lower percent of children stunted at 21%. And this large yellow bubble down here is the United States, with only 3% of children stunted and a life expectancy of 75 years back in 1988. So let's play all this forward and look at what has happened over the decades, and keep in mind that as time passes, new countries are going to pop in on the screen. Right away, you can see that countries moving to the right as life expectancy is going up, and some countries are bouncing up and down as they're trying to reduce levels of chronic malnutrition. That big red bubble down there is China. And when we come to 2006, we see that most of the countries have moved toward that bottom right corner, with lower rates of stunting and higher life expectancy. And while those light blue South Asian countries have certainly made progress in raising life expectancy at birth, countries like Bangladesh and India and Nepal continue to have high rates of stunting at nearly 50%. Looking at those dark blue Sub-Saharan African countries, we can see that they cover a wide range of the graph also in 2006. Now, some of these countries have stunting rates that are comparable to South Asia, while countries like Ghana and Togo have lower rates of stunting and a higher estimated life expectancy. And among the yellow North and South American countries, Peru made significant strides in decreasing stunting over the last 2 decades, and Brazil and Chile making excellent progress in reducing stunting and improving life expectancy, with both countries having made major investments in policies and programs to reduce malnutrition. Now, what this bubble graph is showing us is that there is an association between early childhood malnutrition and a person's health even much later in life. A well-nourished child grows into an adult with fewer chronic diseases that can end life prematurely. So improving growth outcomes in childhood can have a long, long reach into adulthood. So what has the experience and research on nutrition interventions taught us over the years? It's taught us that nutrition is a smart investment because it helps children reach their full potential, providing a lifetime of benefits. Nutrition is a smart investment because it accelerates progress on key global health targets, including reducing deaths and illnesses in mothers and children, and that's helping us to achieve MDGs 4 and 5. And nutrition is a smart investment because it accelerates progress on key economic development targets. And it's truly hard to think of another investment that can accomplish all of that. Nutrition interventions add value to all of our other investments, taking them up to the next level. Some believe that we may be hitting the ceiling, and we may not be able to see additional improvements with investments in health, education, or poverty reduction unless we combat malnutrition. So how do nutrition investments help achieve all of these goals? Well, the story starts in the 1,000-day window of opportunity between pregnancy and a child's first 2 years. This period becomes the best shot at helping a child reach his or her potential, and it sets the stage for life. Let's take a closer look at just how critical this period is. Starting in the womb, before birth, the fetus is at risk if the mother lacks essential vitamins, minerals, and nutrients that are needed for brain, bone, and organ development. About half of all women in developing countries suffer from vitamin and mineral deficiencies during pregnancy. Now, once the baby's born, from birth to the first 6 months, early and exclusive breastfeeding without adding any other foods or liquids is the very best way to ensure a healthy baby. And starting at 6 months, adding nutritious solid foods along with continued breastfeeding is absolutely necessary to make sure that the child grows correctly. Most stunning happens in this critical period. There is no going back. The cost of malnutrition during this 1,000-day window is almost always irreversible. Damage to the brain, leading to poor educational performance and lower IQ, poor growth and development. And remarkably, this early deprivation increases a child's risk of developing chronic diseases as an adult, which we mentioned earlier. And these are chronic diseases like diabetes, blood pressure, and heart disease. All debilitating and potentially life-threatening, requiring hospitalizations and continued attention and sometimes care much later in life. Another huge challenge is that malnutrition in children can happen and persist for years, and we can't always see it. These 3 little girls, Roshani, Rahman, and Sonam, are all from the same remote village in South Asia. And all 3 girls are the same age, but they show very different levels of development. The first 2 girls suffer from stunting and underdevelopment owing to poor nutrition. And it's unlikely that they will ever catch up and reach their full height, or their full weight, or their full potential, like their village playmate there on the right. The invisible nature of chronic malnutrition also sets up a pattern that we see happening generation after generation. This intergenerational cycle of growth failure starts with a malnourished woman. This mother is stunted, and she's at greater risk of obstetric complications. And she also has a greater risk of delivering an infant with low birth weight, like this little baby girl, who's at higher risk of illness and death, and at a higher risk of delayed emotional and intellectual development. And she's also likely to suffer from growth failure in those important early developmental years, which in turn leads to low weight and stunting in the teen years, And that takes us right back to our malnourished woman. And the cycle of poor nutrition perpetuates itself across the generations. Adolescent pregnancy, that also heightens the risk of low birth weight, and it adds to the difficulty in breaking the cycle. We need support for good nutrition during pregnancy and childhood, that 1,000-day window of opportunity, so we can break this cycle of growth failure and turn it into a virtuous cycle with strong, healthy mothers and children. Now, in addition to breaking this cycle, good nutrition also produces economic benefits. Research has found that nutrition investments are a best buy in today's financially strapped environment because investments in nutrition pay for themselves. Healthy nutrition during the 1,000-day window produces a lifetime of benefits for individuals, families, and nations, and that includes producing the most outstanding football players in the league. Healthier children complete more years in school and they have better performance, which leads to increased personal income and can add at least 10% to lifetime earnings. One interesting study from Guatemala showed that the boys who received high-protein supplements in childhood 35 years ago earned on average 46% higher wages as adults than the boys who did not receive the protein supplement. And since healthy nutrition in the 1,000-day window can increase educational performance, well-nourished children grow into a more productive labor force. And that can mean a boost in GDP growth by as much as 3% annually for the country. And if we look at the cost-to-benefit ratio, the cost of key nutrition interventions compared with the savings, investment in nutrition produces returns up to 16 times greater than the initial investment. And that's a savings of $16 for every $1 spent. Let's go back to our bubble graph and look at the relationship between stunting and economic growth. Now here on the left axis is the percent of children with stunting from chronic malnutrition going from 0 to 70%. And on the bottom axis is gross national income per person, ranging from $100 up to $40,000. And back in 1990, South Asia and many of the sub-Saharan African countries had relatively high stunting and low GNI per capita. The big red bubble, China, had about a third of children stunted in 1990 and a GNI per capita of $780. And as we play this forward, we see stunting starting to come down and per capita GNI going up as the countries move to the right. And stopping here in 2005, we have a snapshot view of the world that helps us see some very interesting relationships between malnutrition and economic growth. China now has only about 12% of children under 5 with stunting and a GNI per person of about $4,000. And right beside China is Brazil, with a GNI per person of more than $8,000 and only 8% of children stunted under the age of 5. Now let's compare these two to another economic powerhouse that has shown a sustained and a robust economic growth for more than a decade, which is India, this big blue bubble. India has a GNI of about $2,300 per person, but India has a high rate of malnutrition, with almost half of all children under 5 stunted. And what this tells us is that while poverty is a significant factor in child malnutrition, economic growth does not necessarily lead to reduction in malnutrition. It's other factors that are coming into play. Now, on the other hand, a country like Senegal, which has a gross national income of only $1,600 per person, has a lower malnutrition rate of about 20% of children under 5, and that's much lower than we would expect based on their per capita income. And we're going to come back to Senegal here in a few minutes. We know what makes a difference. 3 well-tested sets of interventions can protect mothers and children, starting with ensuring that mothers and children have access to and that they're consuming essential vitamins and minerals. Secondly, making sure that parents and caregivers get information on improved feeding and care practices and the support that they need to feed their children in the best way possible. And thirdly, making sure that mothers and children have access to the right foods and the right amount of foods, plus access to therapeutic foods to treat moderate to severely malnourished children when it's necessary, like what we're seeing in the Horn of Africa today. In Somalia alone, more than 1.4 million children are in need of supplementary or therapeutic feeding. And that's a stark reminder of the importance of therapeutic foods as a basic intervention to avert deaths in times of drought or conflict or other types of crises. Over the last decade, we've learned much more about how these basic interventions can lead to rapid improvements in nutritional status. And let's take a look at 3 high-flying performers. These are countries which have made remarkable progress in a very short amount of time. Going back now to our bubble graph one last time, we're going to look at the percent of malnourished children in Senegal, Thailand, and Brazil. And on the left axis is a percent of children who are stunted, and it goes from 0 up to 40%. And on the bottom axis is time, which ranges from 1987 through to 2007. And in 1987, we see that in Senegal, about 28% of children were stunted. Thailand had 25% stunted, and in Brazil, 22% of children were stunted. So let's see what has happened over the course of time. Right away, we can see that Thailand and Brazil are dropping dramatically, with Senegal not doing as well, even going up a little bit, but then catching up and going down, down, until by 2007, all 3 countries have much lower overall rates of stunting compared to earlier. Brazil made great headway since the 1980s. The government launched a multi-sectoral program that focused on health and education and nutrition, including a cash transfer system. And that provided vouchers to the lowest income families, making sure that they could buy enough food and the right types of food to maintain good nutritional status of their children. In Thailand, the government implemented an impressive community nutrition program during the 1980s and early 1990s that reduced stunting at a rate of 3% per year. And that's one of the most rapid declines ever documented. And Thailand is continuing to make progress over the last decade, with only about 15% of children now stunted. Meanwhile, we see that even though Senegal got off to a really slower start and it went up a little bit, it's made tremendous progress in reducing stunting since the mid-1990s. After 1993, with support from some international partners, the government of Senegal created the Nutrition Enhancement Program to reduce malnutrition. And that program targeted the poorest districts using village health volunteers who weighed and measured the babies, and they provided food supplements to children nutritionally at risk, and they gave nutrition education to mothers and caregivers. So rapid progress in reducing malnutrition is possible, as these high flyers have proven. Today, we have unprecedented opportunity to make a difference and scale up nutrition interventions more than we've ever had before. New global health initiatives are creating opportunities to integrate nutrition into community-based health interventions, like we saw in the success of reducing stunting in Senegal. New efforts to tackle the global food crisis through expanded investment in food security and agricultural development programs are providing more opportunities to introduce and scale up key nutrition interventions. There are innovative public-private partnerships between agencies and the food processing industry, which could dramatically expand the consumption of essential vitamins and minerals. And on the screen here is an example from Egypt, where flour is being fortified with iron and folic acid and it's baked into bread. And we're also working to create new products that provide vitamins and minerals directly to children at risk of micronutrient deficiencies. For example, sprinkles that come in those small sachets like packets of sugar. They contain a blend of micronutrients in powder form, and it's easy to sprinkle on foods that are prepared in the home. Malnutrition is a global problem. Finding a solution must be a shared responsibility. We have the evidence, and we know it works. We must build on new global initiatives like the sun to scale up nutrition and to create an effective global movement. And global movements don't just happen. We need to band together to build public understanding and much more political will. We need to mobilize additional resources and better align assistance from development partners, recognizing that the private sector has a positive role to play and is likely to be a very important partner in the solution. And we must ensure that key nutrition interventions are integrated into development strategies across all sectors, including health, agriculture, education, rural development, and social protection programs. We can't afford to lose any opportunities. By staying positive and by working together, we can build on our past achievements. We can scale up interventions in that 1,000-day window of opportunity for those who are most in need. And we can keep nutrition on the rise.